Hey everyone, and welcome to this explainer. Okay, if you've got a new puppy at home, you might be feeling totally overwhelmed by the completely normal, yet, let's be honest, utterly exhausting phase of puppy teething. In fact, you're probably mourning a chewed-up pair of your favorite shoes right this second. But don't worry, I am so excited to guide you through this topic today so we can get both you and your pup through it smoothly. So, is your sweet little puppy suddenly acting like a tiny, biting monster? Listen, you are definitely not alone. It is completely valid to feel frustrated when your adorable fur ball suddenly develops these needle-sharp teeth and an uncontrollable urge to literally destroy everything you own, or worse, nip relentlessly at your hands and ankles. But first things first, do not panic. I promise you, those needle-sharp teeth, the constant nipping, and even sudden food refusal, it's all a completely normal part of puppy development. I want to reassure you right off the bat that these frustrating side effects are perfectly natural, temporary biological milestones, and we are absolutely going to conquer them together. All right, let's look at our agenda for getting through this safely. We're going to cover 1. The puppy teething timeline, 2. Normal symptoms, 3. Teething relief and remedies, 4. Training and biting, and finally, number 5, emergencies and long-term care. Let's kick things off with section 1, the puppy teething timeline. Let's look at when to actually expect these teeth. Okay, the magic number here is 28. By just 8 weeks of age, your puppy has a full set of exactly 28 tiny, razor-sharp baby teeth. You might hear them called deciduous or milk teeth, and their whole job is to help your pup transition over to solid foods. And puppies go through an incredibly fast growth arc. It's wild. At 3 to 4 weeks, those very first baby teeth start to erupt. By 8 weeks, like we said, they've got the full set of 28. But then, right around 4 to 5 months, those same baby teeth start falling out. And by 7 months, boom, a full set of permanent adult teeth is already in place. It really shows how they rapidly cycle through these completely different teething phases in just a few short months. All of this rapid growth builds to the final goal, 42. By 7 to 8 months old, your puppy transitions to a massive 42 permanent adult teeth. To put that into perspective, that is about 10 more teeth than we humans have. So honestly, no wonder they feel the need to chew on literally everything in sight. Moving right along to section 2, normal symptoms. Here is what you can expect on a day-to-day basis. During this time, it is totally normal for your puppy to experience sore, inflamed gums, and that discomfort, well, it leads to things like excessive chewing, mouthing, drooling, whining, and even minor blood spots on their chew toys. You might find yourself having a mini heart attack when you see they've dropped rogue baby teeth on the living room floor, which, by the way, is completely harmless even if they swallow them, or when they suddenly start refusing to eat their hard kibble. Now, if they do go off their food because dry kibble just hurts too much to crunch, please don't panic or get upset with them. Instead, try these 3 simple steps to make their meals softer, smellier, and way more appetizing. First, just soften their dry kibble with some warm water. Second, mix that kibble with a tiny bit of wet food. And third, offer an edible, meaty dental chew. Adding that warm water or wet food makes a massive difference, and an edible dental chew can distract them from the pain while actually brushing their teeth at the same time. That brings us to section 3, teething relief and remedies. Let's talk about soothing those sore gums. When you're picking out chew toys, the absolute most crucial rule is the rule of contrast. You must provide toys that have a little bend to them. Things like bendable rubber, freezing wet tea towels, or really anything you can slightly indent with your own fingernail. This gives them relief, but prevents any fractures to those nice, new adult teeth. On the flip side, you have to strictly avoid anything super hard, like antlers, nylon, bones, or sticks. Those can easily splinter, break their teeth, or cause a really dangerous intestinal blockage. For some rapid-fire relief, try giving them these 5 fantastic, natural, vet-approved remedies to instantly numb and soothe their inflamed gums. A wet, twisted, and frozen washcloth works wonders for this. You can also offer chilled cucumber and carrot pieces, freeze up a few chamomile tea ice cubes, invest in freezable rubber chew toys, or even try giving them a gentle gum massage using dog-safe aloe vera. All right, section 4, training and biting. Let's look at how to actually stop the nipping. So, what happens when they decide your hands and ankles are the best chew toys in the house? Well, using the ASPCA's bite imbibition training, you can teach them that teeth simply do not belong on human skin. You do this by mimicking how their littermates would react. They'd yelp and stop playing if a bite hurt too much. So, step 1. Give a loud, high-pitched yelp the instant you feel teeth. Step 2, immediately walk away and completely ignore them for 30 to 60 seconds. And step 3, return and redirect their attention to a safe tug toy. Consistency is absolutely key here. On the flip side, there are reactions you should absolutely avoid. It is so important that you don't use physical punishment. Don't slap their nose, don't wave your fingers in their face, and try not to excitedly jerk your hands away when they bite. Why? Because pulling away quickly actually triggers their prey drive. It encourages them to jump forward, grab at you, or even develop fear-based aggression. You want to keep your limbs limp and boring.
Which leads us to our final part, Section 5, Emergencies and Long-Term Care.
While a ton of teething chaos is completely normal, we need to shift gears for a second and clearly define the serious medical red flags. If you spot any extreme symptoms, like maybe a stick gets wedged in their jaw causing them not to be able to open or close their mouth correctly, or if you see nonstop, persistent bleeding, you must skip the home remedies. Also watch out for excessive drooling that goes way beyond normal teething, an object actually lodged in the throat, or a visibly displaced or fractured tooth. These are not normal. If you see them, contact your emergency vet immediately. Another major medical issue to watch out for is a retained deciduous tooth. This happens when a baby tooth just stubbornly refuses to fall out as the adult tooth pushes through. What happens is it creates a double row of teeth. This causes severe overcrowding, it traps food, accelerates tartar buildup, and can cause some really painful misalignments in their jaw. Now, you also need to be aware of breed susceptibility. If you own a brachycephalic or small breed dog, think pugs, Boston Terriers, or American Bulldogs, keep a really close eye out for these double teeth. They almost always require veterinarian removal to prevent that turtle buildup. But thankfully, this is usually a super easy extraction done by your vet while the puppy is under anesthesia for their spay or neuter. Finally, let's empower you to establish some lifelong habits. Go ahead and book a 6-month dental checkup with your vet just to make sure those adult teeth are coming in perfectly. And start introducing daily brushing with a dog-specific enzymatic toothpaste. I have to stress this, please never use human toothpaste. It often contains xylitol, which is incredibly toxic to dogs. As we wrap up, I want you to remember that before long, the memories of your pup as a nipping, chewing little monster will actually be something you look back on fondly. I know it's hard right now, but this difficult phase is completely temporary. With the right bendy chew toys, a bit of frozen chamomile tea, and some consistent training, you and your best friend will absolutely get through it together and build an unbreakable bond. So as we conclude this explainer, I want you to ask yourself, which of these tips will you use right now to build a foundation for a lifetime of healthy, pearly white smiles? Will it be freezing a washcloth, checking their mouth for retained teeth, or practicing your best high-pitched yelp? Your puppy's dental health starts with your actions today. Thanks for joining me, and I'll see you on the next explainer.